on social media. Also, if you have any questions during the webinar, go ahead and put them in the chat to the host. And we will field those questions after both of the presentations here today. And with that, I'll go ahead and hand it over to our presenters. And we are starting with Jean, who is a licensed social worker with more than 25 years of experience in the Washington, D.C. area. So, Jean, we're going to go ahead and hand it over to you.
Okay, great. Hi, everybody. I'm getting feedback, so it's kind of difficult for me.
So are we, Jean. It's just one moment.
Okay, thanks.
Jean and Alyssa, if you can go ahead and mute both of your computers.
Okay.
Great. I think that helps.
Great.
Okay.
And for some reason, I have Alyssa's slides up, so I'm trying to figure out how to get back to mine. So bear with me here, and here we are. Great. Well, thanks so much for inviting me to be part of this webinar. I am a social worker here in the District of Columbia, and I have been working at the DC Public Library System since May 2014. I'm the only social worker on staff here, and we have 26 branches and our main library, the Martin Luther King Jr. Memorial Library. And I was brought on as I said, in May of 2014, and I was really brought on and charged with figuring out how our public library system could better address the needs of people experiencing homelessness who really spend the day, many of which spend the day in our libraries. We have a pretty robust homeless services system in DC. I'll talk just a little bit more about that later. But nonetheless, options for people who are homeless during the day, particularly individuals, not so much families, but individuals, the options for them are very limited in what to do during the day. And so, like many cities, the library is a default for where people go to spend their day, and it has a lot of great resources. So we welcome them like we welcome anybody else into our libraries. I work in the Programs and Partnerships division of the DC Public Library, and I work for the whole system. I'm not working at a specific branch. I'm trying to be strategic and think about how our whole system can do better.
I ask Christy for this. So every year we do this homeless services pets, we do this.
And there's someone talking on the phone that I'm hearing.
For 2018?
Yes.
Okay.
Alyssa, if you could make sure that your line is muted while Jean's speaking, that would be great.
We serve less people.
Okay.
Decreasing rates.
So I just thought
inverse.
Yeah, because of the tenant-based rent assistance for shelter-less care.
I'm sorry. I can't.
I know. I'm
Got it.
so
Thank you.
Distracted.
Alyssa, if you could put your line on mute while Jean is speaking, that would be great.
Okay. I'll keep going.
I am on mute. That's someone else. So just letting you know, I've been on mute.
Okay. Hi, this is Jean again. I'm going to move on. So I just feel like it's important to give a little bit of context about what was going on in the District of Columbia when I came on board and sort of before that, and because I think it helps as to why DC decided to bring on a social worker for their public library. Like a lot of urban areas, the district was really gentrifying. There were 1,000 new people moving into the city a month, and most of those were folks looking for higher-end housing, and the city lost about 50% of its affordable housing units between 2003 and 2015. And the Housing Authority also became overwhelmed with people applying to its list to get into affordable housing, and so they closed the list with 72,000 people on it. So we saw a real steady increase in homelessness over that time. And that actually, people were concerned, and what it ended up doing is propelling the city to create a strategic plan to end homelessness from 2015 to 20. And so over that time, there's been a more concerted effort to address the needs of people experiencing homelessness. And as a social worker with the DC Public Library, I'm part of that. There were also some things happening at the library that really propelled the system to bring on a social worker. In 2013, 100 frontline staff were hired. We expanded our hours. A lot of those folks were young librarians, never having worked in a public library system, and they were really concerned and struggling with how to meet the needs of folks that were really needy in the library, and they didn't understand, and they wanted some help and some assistance, and there was really nothing going on. So that, I think, really also propelled the library system to bring me on. And there was really no definitive plan for this position. I was not hired to do direct service outreach work. That's a little bit different, I think, than Leah Esquerra, who is the first social worker who was brought on in a system in San Francisco. She was doing real direct outreach work, and I think Alyssa at the Denver Public Library would talk a little bit more about that and what she did when she started. But I was not, and so I was really brought on to take a system-wide approach and then how to leverage the expertise of homeless service providers who are already doing work in the community at the street level, providing direct services. But what I did do when I first started is I was trying to figure out, well, how am I going to tackle this problem for the whole system, is did an all-staff survey and trying to get a handle on, like, what branches were seeing lots of people who staff felt were using the libraries as day shelters, and what kinds of things would staff like at their branches to help them, and just trying to get a little bit more buy-in from the staff about what they wanted. So I was going to be able to address their needs as well as people experiencing homelessness. So pretty quickly, the photo you'll see on the slides is the main branch, the Martin Luther King Jr. Memorial Library in downtown DC. It has I've lived in the District of Columbia for 30 years. It has long been a place where people experiencing homelessness gather, and I think it is known for that throughout the city. So one of the first things I did when I came on was to partner with a local service provider that does street outreach downtown. And we brought in an intern through Pathways to Housing DC who was doing outreach and linkages at our central branch 20 hours a week. And that continued for 3 years. I'll talk a little bit more about why that ended. But and that was a great beginning for people. One of the things that's, this increase in homelessness also, the Martin Luther King Jr. Memorial Library is a place where people were dropped off and picked up every single day who were staying at shelters in outlying areas of the city. So not only was it a place that people were at generally, but the city, the Department of Human Services, was bringing people to that branch in the morning and picking up in the evening there as well. So I originally then started a Homelessness 101 training for staff, trying to help people understand what some of the causes and solutions of homelessness are. Brought on and did a day-long training of mental health first aid, and also started engaging more broadly with the homeless services community in the city and attending Interagency Council on Homelessness meetings so that the library could be at the table and be part of the conversations about how we address the needs of people in the community and how we end homelessness. So then in the fall of 2014, a few months after I started, we also got funding, the library system also got funding from the city to open up a library at the DC jail. And so in addition to my work with people experiencing homelessness, I also took on the role of managing and opening that library, and I continued to do that. And I'll talk a little bit more about that as well. So from 2014 till now, some really great things have been happening in our city around homelessness. The slides, there's still, the number of people experiencing homelessness is still very high. Actually, that number isn't right. That's an old number. We've seen a decrease of about 1,000 people at the point in time count this year. So that's a good thing, although for individuals who are homeless, the number has gone up a little bit, which is concerning. We have some new housing interventions that are available, different kinds of vouchers, both short-term and long-term. There have been more efforts to maintain and build affordable housing, and the city has instituted a coordinated entry system to match housing resources with people. And we have a really robust participation in our Interagency Council on Homelessness. Our mayor is really committed to ending homelessness, and we received funding from, the city received funding from the Substance Abuse and Mental Health Services Administration to get more homeless outreach directed at people who were dually diagnosed, folks experiencing mental health challenges and substance abuse challenges. And the DC Public Library is part of that funding, and I'll talk a little bit about that in a second. And then, but also what's really important is that in April 2017, at our main branch, the Martin Luther King Jr. Memorial Library, closed for a 3-year renovation. So all those people who were at our main library are now dispersed at our branches. So there were folks there anyway, but now there are even more folks at our branches throughout the system, which has really put a lot of pressure on branches throughout the city. So just to talk a little bit more about some things I've done over the last, and the library has implemented over the last 4 or 5 years now, is in addition to the staff trainings, I provide periodically, again, this Homelessness 101 training where I bring a partner agency in to talk about causes and solutions of homelessness, and also a friend of mine who works in homeless services who was homeless for about 6 years. He shares his story, and I think that's really powerful for staff to be able to see this very professional man who was professional in his previous life, became homeless, just to give that human face, because I think oftentimes staff at the branches, really only see someone at that moment instead of a person's whole life, and where they may have come from and the potential that's in them. So I think it's a really important, that personal story is really important for folks. I've also partnered with a nonprofit mental health services provider to do a mental health 101 training for staff. We've started a coffee and conversation program that's been going for about 3-4 years now. It's really targeted at people experiencing homelessness. It happens in the middle of the day, and it's just a time for people who are homeless to come together, talk with each other, talk with library staff, because folks are so often isolated and not seen and might not get a lot of conversation. So this is an opportunity to do that in the library where people are at during the day. We've had 6 of our public safety officers trained as crisis intervention officers. Those are folks who are specially trained to help de-escalate when people are having a mental health crisis, and can also what we call FD12 folks. So if they need to go into a mental hospital, they can. These officers are trained to be able to do that. We also are providing outreach to shelters and participate in the annual point-in-time counts at some of our branches. I think the biggest thing that I want to highlight is this year, as I said, we were part of a grant through the Department of Behavioral Health. They got funding, this CABE grant, funding from the Substance Abuse and Mental Health Services Administration, and we brought on 3 peer outreach specialists who are reaching out to people experiencing homelessness, people with life challenges, people at risk of homelessness, and connecting them with services throughout the city and connecting them with housing. It's been an incredibly inspiring and exciting opportunity for us. The funding actually ends on September 30th, so we are scrambling to try to figure out how we can keep funding that program. Branches and branch staff love it, so I'm confident that we can continue that. I always like to include my hopes and dreams for DC Public Library is that we will eventually have 6 peer navigators, trained outreach specialists, 4 at our branches, and when our main branch opens in January 2020, we'll bring on 2 other outreach people to connect. One thing I really am excited about is having SOAR services. I don't know if folks are familiar with that, but to have someone at the library help people fill out applications for SSI and SSDI and to facilitate that process more quickly. And that's a program we have here in the district, and you have to be trained as a SOAR specialist, but it helps people move through the SSDI and SSI process more quickly. When we open our main branch in 2020, there are spaces, community alliance spaces that will be available, and I'm looking forward to partnering with our Department of Human Services employment services, having housing navigators in those community alliance spaces, and also working with different agencies to be able to bring on-site support so that people can get work at the library to get their IDs, their Social Security cards, and their birth certificate, which is just really one of the things our peer outreach specialists do a lot is to help people get their key documents so they're ready should they get housing, they can move into housing. We are also looking at, I'm also looking at more training for staff, how to have a more resilient staff, and feel like they have the information and materials they need to do their work in supporting people who are homeless as well. And also to bring on comprehensive legal services in the library. This is, I think, a huge need, something we do have a partnership with a neighborhood legal services program, which works with folks who are having legal barriers to finding employment, but trying to bring on other legal services groups that can do more comprehensive work for people. So that's, and one thing that has already happened is the Denver Public Library and San Francisco Public Library coordinated a monthly call for their peer navigators, and I'm excited to report that the DC Public Library is joining, our peers are joining those calls, which is really great. So I think there's a lot more we can do. We're working with the Urban Library Council right now. We are part of a cohort to connect returning citizens to entrepreneurial programs at our library and working to facilitate and create programming around that. So all kinds of different ways that we're working to connect people with life challenges and folks experiencing homelessness. So that's what I got. Thank you so much.
Wonderful. Thank you so much, Jean, for taking the time on this webinar. Some really great information, and I just love how you're really engaging the homeless population throughout your programming, really making sure that their story and their experience is front and center in everything that you do and the trainings that you have going on. That's really what we like to promote here at the National Civic League, and your program is definitely emulating that, and we're glad to be sharing it with everyone here on this webinar. I also really appreciate that you were putting out the different types of work that social work can do in the library system, whether it's system-wide or being a navigator for certain resources in individual branches. So with that, I would like to pass it over to Alyssa Hardy, who is the Community Resource Manager here at the Denver Public Library. Alyssa?
Hi, I'm assuming you all can hear me. You'll let me know if you cannot. Thanks for this opportunity, and thank you all for being engaged in this conversation. It's obviously an important one. As Jean has mentioned, we were the beginning.
Alyssa, so sorry to interrupt. Could you share your screen with us so we could see your PowerPoint slides?
Okay, sure. I thought I had, so I apologize. Here you go.
Wonderful. Thank you.
Okay. There you go. Okay. So as Jean shared, we are next to Leah in San Francisco, the beginning of the social work movement in libraries. And there are many people, many social workers in libraries now. And I know that we all get phone calls from around the country of people looking into these types of services. In Colorado now, we have 3 other library systems that have hired or are hiring social workers. So it's obviously a big topic that we're all working on. So start with this slide here. This is beautiful Denver. It's gorgeous here. And I'll share more about what I'm doing here in a moment and such, but I first want to share a little bit about how we ended up in the situation we're in. So with this gorgeous city, many people want to live here. So we're adding about 10,000 new residents a month. Denver has grown a lot. I moved here in 2005, and it was still kind of, we call it a little cow town, and it was pretty inexpensive to live here. And now it's not so much. We know that many neighborhoods are gentrifying, and we know gentrification displaces low-income residents. Also on here, I have, that's a picture I took in my neighborhood as I was walking around one day, and just kind of showing the different landscape of what we're looking at in our old neighborhoods. And I just kind of, as Jean so well explained, the kind of what led up or what's been happening in D.C., I want to share a little bit about what's been happening in Denver over the last few years as well. So clearly homelessness is not a new issue in our country or in any city, and Denver included. However, around, the 1980s and beyond, we're starting to see an increase in this. And so trying to, look at why and what can we do about it. In 2005, when I moved to Denver, I actually worked in the Housing First program under Denver's Road Home, which is the city's approach to ending homelessness. And initially, it was a 10-year plan. We're a little bit past that 10-year mark. We haven't done that yet, so we're still working on it. But this committee, the Denver Road Home Committee, still is working toward better solutions all the time. And so Housing First is basically a model of housing, and it's exactly what it sounds like. We engaged folks who were living on the street, put them into housing without any requirements other than they agreed if they had an income, pay 30% of their income per month for their rent, and then meet with their case management team. And so this is we did a pretty successful. We had a pretty successful program with this, and it continues to go on today throughout the agency I worked for. And with that, too, we also the city created Denver Street Outreach Collaboration, which is a collaboration of different agencies doing street outreach work, and engaging people, an increase in shelter systems, so an increase in the number of beds, things like that. What we know, though, is these models don't work for everybody. We do have some gaps in our shelter system. First of all, not everyone wishes to stay in a shelter for various reasons, including trauma experiences. And in Denver, we don't have a shelter for heterosexual couples, so people of, who identify as male and female can't stay in a shelter together. There's limited space for single fathers with their children to stay. It's mostly targeted towards single mothers. And pets are also a barrier to accessing shelter a lot of the time. So also in 2005, Denver created a sit and lie ordinance, which meant that anywhere in the downtown area you cannot sit down or lie down in a public space. And so this certainly started to put a little bit of pressure on the people who are living outside. And I believe at that time, people were really trying to find more places to be, and that includes our public library system. Obviously, the public libraries are not, this isn't new for public libraries. They have people who are unhoused within our walls, but this certainly increased a little bit of, increased the population, number of people coming in. And this is, our weather's pretty mild, also why people want to live here, and it's not too bad outside most of the time, but it did push people inside from outside. In 2012, the Denver City Council passed a camping ban, which meant that people cannot camp in a public area within the city and county of Denver. And obviously that's created some issue for folks who are unhoused. Many people who were staying downtown, which is close to services, were pushed out further under the bridges, under the interstate, further away from services. So it's a little bit more difficult for the street outreach team to engage these folks because they're a little bit harder to find. And then between 2012 and 2018, our housing costs skyrocketed. In March of this year, a Denver Post article said that the average price of a single-family home in Metro Denver passes the $500,000 mark. And for a city, a town that really had not been that expensive before, it suddenly very much is. And in the 2017 point-in-time survey, so Jean mentioned the point-in-time survey as well, and what that is there's many cities across the country that do a count once a year on the number of people who are not housed, and whether they're shelter accessing or not shelter accessing. So it's the best we can do to try to get a number. We know that the numbers are always underrepresented because we can't count everyone, but it gives us a little bit of an idea of what our numbers look like in each of these cities. And then in 2017 in Denver, our survey counted 5,116 people. For our 2018 survey, we counted 5,317 people. So we actually went up about 200 folks. What was really interesting with our survey this year, too, is that most of the people, or we had an increase in the number of people who are newly unhoused. So, again, looking at these rising housing costs, gentrification, all this stuff, is certainly having an impact on our community. And people who have had homes and lived in their neighborhoods for decades are now finding themselves moved out. And also this year, the restrictions that keep affordable housing affordable are set to expire on about 2,300 units in the next 2 to 3 years. Denver also has there was a Colorado Supreme Court decision that said that, we can't have any rent control in our community and things like that. One thing I can share now is that our city council is currently has put forth a proposal that would force landlords to accept housing vouchers, because what we're also running into is if people could get the housing vouchers or Section 8 vouchers to get a place to live, no landlords were taking them. And we didn't have requirements for landlords to have to accept that type of income for rent. So our city council has proposed that. City council will vote on that this month in August, and if it passes, it will go into effect in January 1st, 2019, which means that landlords have to accept this, housing vouchers for people who might be low income. And they can't discriminate against that. If they do, then they will receive fines by the city. So that's the movement in a positive direction for our city. It's coming a little bit late and a little bit behind what's been going on, but at least it's something and should have a little bit of an impact. Okay, I'm trying to, my slides are not moving. Okay, sorry guys. Oh, there we go. All right. So this is a picture of the front of our central library here in Denver. As people are waiting for the doors to open at 10 o'clock. It's not unusual to have quite a few people out there every morning, especially when it's not very warm outside. And so every day here at our central library, we have about 2,500 visitors that come through our doors. And I don't know the number of people that come to our branches, but clearly they're not quite as busy, but are still busy considering their size, because many of them are quite small. We have 26 total locations in our system, including our central library. So a little bit about my job and how we got here after looking at that history of what's happening in Denver and ongoing in our community. At DPL in about 2011, there was a creation of a Homeless Services Action Committee put together by different library staff, librarians, administration, security, and other folks who recognized, it's kind of like what Jean explained, it happened in D.C., recognized that we have, this population coming into our buildings. Are we really doing the best we can to serve them? Because people do come in and ask, hey, do you know where I can get some food? Do you know where I can access shelter? There are a lot of people moving through Denver, so we have a lot of people who are new in town who come in and ask these questions. and, also needed support applying for SNAP benefits or needed help with health care. And we had a huge Medicaid reform with the Affordable Care Act. And so librarians knew how to get the information for that and access that for people, but didn't really have, that's not their skill sets to help people navigate that whole system. So that's where social workers can come in. And so with that, they proposed to the city to follow what DC and San Francisco had done and create a social work position. So my job was created in 2015, so I started here in February of that year. It was initially a 2-year temporary position. The mayor's office said, see what you can do. We are not quite sure why you think you need this, but go for it. And within the year, they made my position permanent because they did recognize the need and added a second position in 2016. In 2017, we created our Peer Navigator program, and Jean talked a little bit about her Peer Navigators as well, and I'll add to that here in a moment. But we initially started that, those positions were grant funded, and because the city had never, worked with peers before within their job structure and all of that. So we had to get really creative, and so we created a collaboration between ourselves, our Department of Human Services, and a nonprofit in town that trains people in recovery to become peer navigators or peer recovery coaches. And initially, that nonprofit employed the peers and contracted with them for them to work in the library. And I'll share more about that here in a moment. And then this year, we created a third and fourth social work positions. So we actually now have a team of 4 peer navigators and 4 social workers here in Denver, which is so great. We would hope that we wouldn't need that many folks that are, the issues kind of start to decrease, but the truth of the matter is homelessness is not going away anytime soon, and with our society, with our system and our system's failures in our country, with these rising housing costs in cities, and mental health treatment and substance treatment not being readily available for people. So we really are going to be continuing to see more and more issues coming through our libraries. And we have this conversation here a lot about how I think that we do have some staff here that think that, eventually they won't have to bear witness to people experiencing homelessness within our libraries, but I anticipate that the population will grow within our walls. That's how we got here. A little bit about what we're doing. So we also are providing training for staff. So that includes kind of that mental health first aid approach for libraries. Jean mentioned this as well, that she was able to bring this into her library. We have a collaboration with our Mental Health Center of Denver where our staff can attend the mental health first aid training they provide for free. And I currently have the new social workers working on a kind of a mental health 101 that's more appropriate for libraries to bring a little bit more understanding about what we do see in our walls, to just have a better approach and more, engaged with the library staff. And that the mental health first aid is a good training, but it's a little bit overarching, and so we want something more specific. So we're in the process of working on that. In addition, we do the Homelessness 101. As Jean mentioned, she also does that. So it's, again, where we just talk about the experiences of homelessness, what that looks like, what people, what the challenges are, the barriers are to move out of that. And within that, we're kind of redoing this with the new social workers that are on board now, too. We're going to also have one of our peer navigators who has had experiences of being unhoused join in that training to bring that voice of experience and recovery to the story, to the information. We also do a trauma-informed systems of care approach. And what this does is talks about how trauma affects our lives. Whether we know it or not, we're all affected by trauma, whether that's directly, like we've had our own traumatic or at least stressful situations. And a lot of the people that we see walk through our doors have experienced trauma. And whether we know it or not, their experiences affect us vicariously, whether we're having a conversation with that person and they share information, whether we're just witnessing all these people walking in with their entire, all of their belongings on their back every day, being able to leave at the end of the day and go to our homes, but knowing that a lot of people leave the library when they close at the end of the day and don't have homes to go to, all those things affect us. And so we want to talk about that. We want to talk about how that affects us, because what happens if we don't is that people withdraw and are not as engaged in their work, or, there's other negative aspects to what happens. So we need to talk about these things and build that resiliency. So we do a training, Finding Resiliency and Approach to Self-Care. And I'm actually taking a step back on this one right now because while this training has been positive for folks, we also are recognizing we need to do something bigger. So I'm actually looking at collaborating with some community partners that do some resiliency training to bring that in for a more robust kind of workshop training for our staff. And so we're in the middle of working on that. I also talk about in that training the intersections of mental health, substance use, and trauma. Last year we had a lot of we had a situation where we had a lot of people who overdosed in our library, and we started carrying Narcan. We also did the Narcan training, and that was really traumatic for people. It's first of all really scary to witness that. Also, when we don't understand something such as a mental health issue or substance use issue, things that are going on in people, that's scary to us. And so we really, again, want to talk about that and help staff have an understanding to, help them be able to do their jobs, but also to increase that empathy and compassion for the populations that we do serve. So again, we also do the training for, Narcan use. Our security manager does that. We have around a little over 600 staff that work at DPL. We have over 400 staff trained. And all of our branches have a Narcan kit, and staff are trained within those branches to use it should it happen. And here's our central branch. My team carries Narcan, our security team carries Narcan, and we have it at a few of the desks around the building as well. We're also doing a lot of programming for our customers. We first of all have this really great writing program, Hard Times Writing, that is a collaboration between Lighthouse Writers Workshop here in Denver, the Denver Voice, which is the newspaper that prints stories of experiences of homelessness, and it's the newspaper that people experiencing homelessness can sell to make money. So, and then DPL is the third partner in that program. And that program's been going on for a little over 2 years, and it is absolutely incredible. There are at least 20 people that come to that every week. And they formed this relationship with each other, and they get together outside of that writing group. They go to lunch, they go to each other's places and hang out. They're always writing together and supporting each other. And it's really created this amazing connection for people. And we as social workers, say this a lot, and we know that healing begins with relationship. And so it's really creating that for people. We also provide a meditation for people, and our programming doesn't, we're obviously not checking income at the door. Anyone can come, so we do want to bring different groups of people together, especially unhoused and housed people together, to help increase understanding of homeless issues, because we really need our communities to be engaged in helping us solve the issues. So we're trying to do a little bit of that. So anybody can come to these programs as well. We also do the Coffee Connections. It's the kind of the same premise as Coffee and Conversation that many other libraries are doing, including DC, as Jean mentioned. And so how we have it set up at DPL, we do this once a month. It's in the morning, because we actually have a lot of people who kind of come in that first when Susie opened at 10 o'clock, we have a rush of people coming in. And so we provide, coffee and donuts, and we rotate different staff groups or programs within the library. They rotate hosting that. So, for example, 1 month security hosted it, the next month Books and Borrowing hosted it, the next month the Children's Library hosted it, because we want to pull all staff into this involvement. And last month, actually, our IT group hosted adopted it, and their manager had shared with us that they were a little bit terrified before we did this. Afterwards, we couldn't hear enough great things from that group of people because they're behind closed doors all the time, and they don't get to interact with the folks. So that was a really positive experience for them, and that's what we're trying to do for everyone. We partner with many agencies, and we can't do this work alone. So work with everybody in the community. You can see the picture there of the Bayon's laundry truck. They now have 2 of those laundry trucks. The greatest gift that Denver's ever gotten. So we have the laundry truck here once a week at our central library, and it goes to a couple of our branches once a month. And it is our biggest success. They do, I'm not even sure, hundreds of loads of laundry every time they're here. And people are lined up before they even park the truck with their laundry. So they have the washer and dryers on the truck and then folding tables outside. Again, it's a place where people can engage and get connected. And Bayot is actually a nonprofit in town that provides employment training and support, as well as, helps people apply for Social Security and does a lot of other, and housing as well. There's a lot of other great support for the population that's housed. And so they get connected just by doing their laundry, which is great. They obviously have the Peer Navigator program. I'm going to talk about that more here in a second. And then I think it's also important for us as the library to be a part of the big picture solution. As Jean mentioned, when she started, there wasn't a definitive plan for her position, and it was the same with mine. They were just kind of like, go for it. And so I started meeting with people, kind of getting an understanding of what was going on, getting involved in those community meetings, including our Denver Street Outreach Collaborative, our shelter and service providers meetings, all of those things, just the network. And now that I have more people on my team, they're doing a lot more of the direct service work with the customers, and I'm able to do some more systems approach like what Jean has been able to do. And one piece of that is that I'm co-chairing the leadership committee for our citywide collective impact and opioid use. And so we just published our strategic plan a couple of weeks ago. The mayor mentioned it at the State of the City, and it's pretty robust and pretty amazing. And Denver Public Library is actually hosting the Denver's event for Overdose Awareness Day on August 31st. So where, 2 years ago, we were kind of afraid to have this conversation about overdose, about Narcan, all of this stuff. We now are hosting this big day, and the mayor and his appointees are going to be trained in Narcan use that day in the library. So we're pretty proud of that as well. I'm going to try to switch slides here. It's a little slow for me, so bear with me. The next slide, as I try to pull it up here, is services to customers experiencing life challenges. That's it's just kind of some stats, and I won't go into that too much. And hopefully I can pull it up for you guys. What we've just really seen, obviously we've had an increase in the number of the staff on our community resources team with the addition of peer navigators and social workers, but then also we just have had a lot more people coming in and connecting with us as well. So we have had an increase in our numbers, and that continues to be true as we move forward this year and such. Sorry, I'm trying to get this slide to work for you guys. Let me pull this one up here. Okay, that's not what I wanted. There we go. We're getting somewhere now. All right, so this is Quika and Jonathan. They're 2 of our peer navigators. Quika is wearing her rainbow fanny pack where she carries her Narcan. And we did a safety survey with our staff last year and this year, and we need to revamp that and ask some different questions. But this is just some feedback that we got in that survey about the peer navigators in our social work program. Just kind of demonstrating the need within our system, and why this was so important to have these positions to help support the staff as well as the customers. Yeah, so hopes and dreams, kind of like, what Jean brought up here too. So first of all, I'm going to go kind of back to that information about the peer navigators is initially those positions were grant funded. Our grant funding ended at the end of June. Part of the reason for that, we have additional grant money that was awarded to us, but it was a federal grant. And because Denver is seen as a sanctuary city by the government, we did not receive that money. So we had to scramble a little bit and figure out what we were going to do to keep these peers employed, as well as a part of our library, because they're so important, because they're able to connect with people on that peer-to-peer level, have that conversation, hey, I also have a diagnosis of bipolar disorder, let's chat, or I've been where you are, I've been that person that's been, in the library and injected, and I can have this conversation with you and help you get the treatment if that's what you want to do. We can also work on the housing and do that centralized intake process that Jean mentioned that DC does too. So we were able to create, for the rest of 2018, starting in July, city-funded positions for the peer navigators, which was huge because, again, the city had not known about peer positions before, and so they granted us, we have some vacancy savings, salary vacancy savings, so we're able to fund those for the rest of 2018. We're hoping to request, what we have requested in our budget request for 2019, continuing funding, ongoing funding for those 4 positions and adding 2 more peer navigator positions, so hopefully we'll have a total of 6. And actually now the city is looking at how to expand its navigator services based on our model in the library. So that's good news, and we'll keep working on that positive movement. So we also want to create, a Master's of Social Work student internship program, and actually I've kind of talked about a little bit about bringing in MSW and library students together and helping them work together more, because I think these 2 disciplines can do a lot of great stuff together clearly, and we want to bridge that a little bit more. So we're kind of having those conversations. With those 2 new social work positions, what we're doing with those is we've expanded our coverage to the entire GPL system. So one of those social workers covers 10 branches on the west side and also supports our Services to Immigrants and Refugees programming. And our other social worker, she's covering the east side of the city. She has 11 branches and is really our family youth expert. And then we have that other position who's our central social worker, and he covers the downtown area. So the central branch, or the central library, as well as some of the downtown branches. So we're out there. We want to really support anyone experiencing life challenges. These social work positions are really initially created to support people experiencing homelessness most of the time, but I think that we can go beyond that, as we're really trying to do here. So what we're really doing is doing a needs assessment of what's going on in the communities through a social work lens. Obviously libraries have done their own needs assessment on their communities, so we kind of want to bring in that social work lens along with that library lens and pull that together to see how we can serve our communities better. And then also providing some hands-on training for our custodial staff and librarians. They have them shadow our peer navigators doing outreach to help decrease fear and hopefully work on some of that vicarious trauma stuff. And then our peer navigators are working on developing programming for customers that includes like our wellness recovery action planning, harm reduction and recovery, Social Security and benefits. Jean kind of talked about that a little bit too, more housing access. We also collaborate with a program through the city of Denver called the Denver Day Works program, and they partner with Bayard, who has the laundry truck, where they employ people who are experiencing homelessness to come in and work in city agencies and some other agencies around the community. And oftentimes the goal of that is for those people to then be hired on permanently at those agencies. And I know we've hired at least 2 people into the library system from that partnership and plan to do more of that. So that's just, in a nutshell, what we're doing to support our vulnerable community members. I'm going to transition us to hopefully, our question and answer slide. So we can continue our conversation more. Thank you for your time.
Wonderful. Thank you so much, Alyssa, and I like that question and answer slide. We did have quite a few come in through the chat during both presentations, so we can go ahead and get started with those. So one question was, what partners have helped with funding? And it was originally for Jean, but we'll have Alyssa answer that one as well.
This is Jean. So my position is funded through the library. I'm an employee here, and we're city funded. The peer outreach specialists or peer navigators are funded through our DC Department of Behavioral Health through funding they received from the Substance Abuse and Mental Health Services Administration for this specific grant to reach more people experiencing homelessness with dual diagnosis in the city. And we're one of 5 organizations that are funded through the Department of Behavioral Health.
Wonderful, thank you. Alyssa, do you have any other partner organizations that help with funding?
Yeah, sure. We're fortunate that our social work positions are funded through the library, through the city and county of Denver. But again, when we partnered to create those peer navigator programs, we looked at the best partnerships, and we wanted to include the Department of Human Services because they had a lot of success with the grant that we applied for, that federal grant I mentioned a little while ago. So that really helped. They had a good track record with them. And then the nonprofit that we looked at like 4 different nonprofits that do peer training and hiring, and decided to go with the one we decided to go with because of their robust peer training. We don't get any other funding currently. We are looking at other grants or even corporate partnerships to help supply supplies for like our programming as well as outreach supplies. Our peer navigators do walk around with hygiene products, granola bars, water, things like that. So we're always looking for some additional funding to support that type of those engagement materials. And then we are looking at applying for 1 or 2 IMLS grants to kind of further our research on this work.
Great, thank you. And then if you could both talk a little bit about how your position came to be. I know we've got some people on the webinar who are interested in starting this program, but might need some help kind of convincing the powers that be in each community that there is a real need and that this will be beneficial. Jean, we'll start with you.
Okay. Actually, you know, we're a pretty well-funded library system, and when they asked for money for this position in our budget, it was there, and I've been just a line item in the budget ever since. So it wasn't a big struggle. I mean, I think the struggle that happened internally within the library was, do we hire a public health nurse or do we hire a social worker? And they just decided that a social worker would be a better fit. So that's my story.
Well, great. It's nice to have so much support. That's really wonderful. And
yes.
Alyssa, what about you?
Yeah, I think, I'm really lucky to live in a pretty open-minded city that, wants to be a part of the solution, and our mayor's administration is really in support of a lot of the work we're doing. And I think we're just really lucky in that regard, and so we haven't had a lot of resistance or challenges to that. I would say, before I came on board, that the library did have their work cut out for them in convincing the Library Commission on creating social work positions. They were a little concerned about mission creep and, if you build it, they will come kind of thing. And, they were really, the library staff was able to, share that, people are already here. We need to help them better. And so that helps. Other than that, we haven't met too much resistance. You know, when there are articles, media that goes out, there's always, you know, someone in the community that doesn't quite understand. But other than that, we haven't had too much difficulty.
Great, thank you. We had a question for Jean. If the library staff is trained to use Narcan in the DC libraries as well.
No, we have decided not to train people. The opioid epidemic is a little bit different here in the District of Columbia. We just don't see the kinds of use in our system that I think other library systems in other cities see. There are a lot of heroin users in our community, but these are folks who are probably in their 50s and 60s who have been using heroin a long time. And just in our library system, we're not seeing, you know, sometimes we see people who have OD'd, but pretty rarely. We're kind of keeping track and in touch with our Department of Behavioral Health and our Department of Health to sort of track what's going on. But it surprises everybody that there's just not this intensity in the District of Columbia around opioid use, which we're thankful for and hope it stays that way. But you know, we'll see.
Great, thank you. And then you both had programs, I think it was Coffee and Conversations and something similar in Denver. How did those two programs come about, and what results have you seen from those?
So actually, this is Jean. I took that program from the Dallas Public Library System. I heard about something that they were doing similar at their main branch and decided that we would try it here at our main branch. And I recruited some librarians who were interested in bringing together folks every couple of weeks to have conversation, to do a craft, whatever it was. And it was really important, especially as we were preparing to close our main branch for renovation. We had a lot of conversation with people about the closing, what they wanted to see in the new MLK library. So that was really a wonderful opportunity. And then I expanded it. People were interested at some of the other branches where a lot of people experiencing homelessness gather. And, you know, it's sort of ebbed and flowed, and now our peer navigators sometimes lead Coffee and Conversation at some of the branches they're at. And I think it's just created a more welcoming environment for people and feeling like they belong at the library. It's not something everybody is interested in, but it is something that I think for a lot of folks, it just gives them something to look forward to and a way to connect with people at the library. One thing we're also doing is we're training our staff right now, some of our staff, about 14 people, in a dialogue facilitation model to offer community dialogues on hot topics in the community. But also this came about because we wanted the folks who lead Coffee and Conversation, the librarians, to be able to have the skills to go a little deeper with people at Coffee and Conversation and how to create a dynamic dialogue that can really perhaps be more profound for people. So we're just in the midst of training staff around dialogue facilitation, and we'll be looking forward to implementing that in separate programs, but then also at Coffee and Conversation as well.
Yeah, this is Alyssa, and I'm going to get with Jean to get information about this training. That sounds great. we actually started our coffee, we call it Coffee Connections. It's the same, premise, and we, looked at, we saw Dallas was also doing it. And we actually had an IMLS grant in 2017 targeted for programming for people experiencing poverty and homelessness. And so with that, we had some other stuff. We had some art and yoga. It helped people with meditation and the writing group. And then it helped us kickstart this coffee conversation or coffee connections group that we have. And now we have it written into our books and borrowing budget that they do our programming. And so that's how we continue to do it. And then it's just become an expectation that those different programs participate. Our central administrator here at DPL is a huge supporter of the work we're doing. She's actually my supervisor, and really does a good job encouraging people to get engaged. And what has happened, we did a debriefing after the IMLS grant ended, and one of the librarians who had been a part of actually the meditation group, but then also the coffee group, shared that it really helped him understand that everyone is in the same place, on the same level, and that we just have different experiences. And so it kind of built these relationships and bridged those gaps because people, for some reason, really try to separate people who are housed from people who are unhoused. And the thing is, there's people having these human experiences. So it really helped with that. And what I have actually heard from people who've come to the coffee connections is, hey, thanks for letting us know you want us here. A lot of us come here because we don't have anywhere else to go, and we know that the library will let us be here, and we appreciate that. This actually told us that you want us here, and you want to get to know us, and that doesn't happen anywhere else. And so that was so powerful to hear that statement, and really, Jean mentioned earlier about how people feel invisible because, again, people want to separate those two groups and not look it in the eye and look homelessness in the eye. And so that's, it's really helped decrease some of that feeling and helps people feel like they do have ownership in the library as well.
Wonderful. Thank you both. Yes, the best programs are usually stolen ideas, so we hope that that's what we're doing with this webinar as well, and that these kind of programs can continue around the country. And here at the National Civic League, we facilitate a lot of community dialogues and love to hear that the DC Library is doing that and really pushing that facilitation. And it's also nice to hear that through that, those conversations previously, those experiencing homelessness were able to really be a part of what the MLK Library would look like when it reopened. So that's fabulous to hear, and really great that it's getting housed and unhoused people, in the same conversation and meeting each other in the Denver Library. So thank you for sharing that. Another question came through, if the libraries are designated locations for point of access for homeless coordination entry. Do either of you all do that?
You mean people who want to, who are just coming right into the homeless services system and how to connect with services? I mean, we're not. That's what I'm understanding. No, we are not technically a point of entry for people into homeless services, although because we have peer outreach specialists and people just come into the library and ask library staff, where they can go to get a shelter, and they're asking peer navigators where they can find food and resources. We're an unsanctioned, I guess I'll say, point of entry for people, if that makes sense.
It does. Thank you.
Yeah, here in Denver, we can be the point of entry into services because what we have recognized here is that a lot of the people we meet with in the library are not service connected. in any way, which is a little bit shocking and sad in some ways. So we do connect people to, those other resources and help them navigate that. Our career navigators do most of that work. In addition, I wonder if someone's kind of also asking about the coordinated entry for housing. And so what that looks like in Denver, and different cities do it differently, is they have different questionnaires or surveys that people fill out. And so in Denver we do, it's called the VI SPDAT, or the Vulnerability Index Specialized, something tool, assessment tool. And we do complete those with people here at the library. And we have had maybe around 10 people who've done the VI SPDAT here get pulled for housing, whereas they were not going to, likely do that in another place. So we consider that pretty important.
Great, thank you. So I know that we are past the hour, so if you have to jump off the webinar, we understand. But if the speakers could stay on, we've just got about 3 more questions. 2 of them are pretty straightforward for Alyssa. What was the federal grant that originally started your position?
Sure. That originally started the peer positions. My position was fully city funded, but the peer positions, it was a justice assistance grant through the Federal Justice Center, I believe, is the overarching agency. And so our goals were to help decrease recidivism into the criminal justice system and decrease security contacts and UPD, or police department, and 911 calls within the library were our metrics initially with that grant.
Wonderful, thank you. And then also still for Alyssa, is this sit down, lie down still in effect?
It is. And there are some really active homeless service agencies that, do a lot of advocacy for the population. And so every year since, there has been legislation proposed to end that, and it's not been passed every year since. And there's a new proposal going in this next year called The Right to Survive, being proposed by homeless advocacy groups, which basically, says that people can sit and lay down and rest in any public space, which, creates some concern within the library as well, because we don't let people lay down here or sleep either. We give people 3 shots a day of sleeping, and after the 3rd time, you just need to wait for the day and go walk around. We try to intervene before that happens, but so it's still in effect. And again, advocacy groups are trying to change it, but they've hit a lot of resistance.
Great, thank you. And then a question for both of you. Having interns work on the program, especially Masters of Social Work students, how do you all do the supervisory role, since a lot of library staff are not social workers?
This is Jean. We don't have, we do not have a social work interns right now. When I was partnering with an agency, Pathways to Housing, they were doing the supervision. But I'm a social worker, and so I am able to supervise social work interns, should we get them. And hopefully someday we will.
Yeah, this is Alyssa. So I had an intern a couple of years ago, and I realized at that time how much work having an intern is. It's kind of an additional job. And so I held off on it until I've gotten these other social workers on board. I don't know that we're going to have any interns this coming year, but hopefully the next year we will. And they all of the social workers on my team are interested in being supervisors, and as social workers they can do that. I do know that there are some library systems that have had social work interns come in and do some work because they can't afford or create a social work position within the library structure, and they've been supervised by another agency or someone within their academic program. And I think that's, an idea. It's certainly, a good effort. I do have some concerns about that because I have seen a lot of crisis doing this work within the library, and an intern without that experience of knowing how to fully handle that, I think that's too much for them without a supervisor on site. So just something to consider if you're thinking of going that way. But many agencies would probably be willing to work with you on collaborating and having an intern come in if you want to do that, and they can provide the special work supervision.
Great, thank you. Well, I know we are 15 minutes past the hour, but those are all of the questions that came in through the chat. And we appreciate both of you, your time on here, and the great work that you're doing in Denver and DC. We will be sending out an email follow-up here shortly, and it will have the recording of the webinar, a few additional resources, and a quick survey that we do ask everyone to fill out so that we can continue to offer better webinars in future months. So again, thank you so much, Gina and Alyssa, and hopefully everyone enjoys the rest of your Tuesday.
Thank you.
Thank you.